everyone, welcome to SF Live this Thursday night. My name is Rebecca Taff and I will be your host. My guests tonight are from the NICOS, Chinese Health Coalition. Kent Wu is the Executive Director and Michael Liao is the Director of Programs. So thank you guys for being here.
Thank you for having us.
And if you guys at home go to Vegas occasionally or are interested in a little gambling, you might want to watch this program. But first we're going to start just generally about what is, how did you say it? NICOS? What is the NICOS Chinese Health Coalition?
Well, NICOS Chinese Health Coalition is a public-private partnership of more than 30 health and human service organizations. And our mission is to enhance the health and well-being of San Francisco's Chinese community. A lot of people don't realize it, but there are more than 120,000 Chinese living in San Francisco and comprise more than 20% of the population here. We're engaged in a number of things. We do research, training, coalition building, and program implementation. But our main goal is to do advocacy work on behalf of the population.
And how did it start? How long have you guys been around? What happened? How did everyone come together?
Well, NICOS was formed in 1985 when 5 of the largest healthcare organizations in Chinatown came together and said, instead of fighting among ourselves for resources, why don't we join together and advocate for the community as a whole? And so that's what they did. And the name NICOS is actually an acronym for those 5 founders.
I know, I was like, what is this?
Yeah.
But it's sort of lengthy.
It's a long explanation. So
okay.
N stands for Northeast Medical Services, which is a nonprofit clinic. I stands for the Independent Practitioners Association, also known as the Chinese Community Healthcare Association. It's a Chinese physicians group. C stands for Chinese Hospital. O stands for Unlock Senior Health. And S stands for Self-Help for the Elderly.
Wow.
So they
You guys
met
must
in
do
85.
a lot.
We do a lot. So it grew from those 5 organizations to more than 30 organizations today.
So what kind of things do you do, or who do you work with, or what are the organizations that you work with?
Well, there's a few programs that we have that we're best known for. One is the Family-Centered Outreach Enrollment and Education Project, which is one where we enroll low-income families into low or no-cost health insurance programs. And then beyond that, we also help them access care. We put on an annual health fair that serves about 700 to 900 people every year. And then we do a gambling project, which provides a helpline number and also provides individual and group counseling.
Oh, good. Well, that sounds interesting, and Michael will be talking to us about that. But where are you guys located in one central place, just in case people are wondering, or do you have like different?
We're in San Francisco, Chinatown,
Okay.
1208 Mason Street by Washington.
So if people have any questions or need anything, they can just show up, or do people need appointments, or how does it work?
Usually we go by appointment, but they can just drop in if they're just picking up information.
Okay, good. And if you have any questions about that, you can go to NICOS.org. Yes, that makes sense. All right. Well, thank you. So let's talk a little bit about the gambling issue. Michael, tell me all about it.
Sure. Let me first define what problem gambling is, because this is something that actually not a lot of people have a real understanding of. Even for people who work with similar issues like mental health and addiction, there's really not much awareness of it. The definition we use actually comes from the National Council on Problem Gambling, and it lays it out very clearly and generally that problem gambling is defined as any gambling behavior that causes disruptions in major areas of someone's life. So it could be like in their relationships, they're spending so much time at the local car clubs or racetracks that they're missing out on family gatherings. They're not really spending time with their kids, or maybe in areas such as their work or school, because they're becoming so occupied. They're constantly thinking about the next opportunity or next excursion to Vegas, like you were saying. That they're unable to perform their jobs, or their grades are slipping, or even things related to their physical or mental well-being. So we see people, we've heard a lot of stories of people who stop taking care of themselves. They are not eating right. They're losing a lot of sleep because they're becoming so entrenched in that phase of chasing their wins and chasing their losses and things like that.
Well, let me ask you, because I know a lot of people gamble. I mean, I go to Vegas and gamble, and I'm just I go to Vegas, gamble, come home, don't really think about it. And why did you guys, as sort of focusing on the Chinese population, why do those things sort of go together, the gambling, and then why are you guys focusing on that?
Well, we actually came across the issue sort of by accident. In 1998, we conducted a health study called the Chinese Community Health Study. It involved 1,808 Chinese American adults in San Francisco and was conducted in several languages English and several dialects of Chinese. Purpose of it, again, was to develop a health profile of Chinese American adults, just to counteract the model minority myth. But in addition to all the health questions, we also asked one social question, and that was, among all these, what do you consider to be a problem for your community? And it turned out that more people identified gambling than any other issue.
Really?
So-
And that was the only one question, the only one question that you had on there, the one social question? And this that's a lot of information from one question.
So, yeah, so because of that, we felt we need to address the problem.
Oh.
70% of people identified gambling as an issue.
Really? Wow, that is amazing. Can you tell me more about what you guys have done to address it?
Sure. Would you like
Or what kind of programs that you have in place for it?
We have a couple of gambling projects right now. So one is the Chinese Community Problem Gambling Project, and the other is the Problem Gambling Technical Assistance and Training Project. So the one is specific to the Chinese population, and we have a helpline for it, and we offer individual and group counseling. We also do some general awareness building in the community to let people know that gambling is okay, but if it gets out of hand, there are resources available to help you. And then there's the Problem Gambling Technical Assistance and Training Project, which is one that we do statewide and with all populations.
So
Michael
that
can talk a
one,
little bit more about that.
That one we actually started around 2006, so this one's fairly more recent. But we realized early on that a lot of service providers, people are like clinicians or counselors, or even teachers and doctors and nurses, aren't routinely asking their patients or clients questions about gambling, and so that we're realizing a lot of problem gambling is going undetected. And those people aren't being referred for services that they could actually otherwise benefit from. So the project was really aimed to raise awareness among service providers, give them the tools, teach them what questions they can ask, for example, to be able to identify problem gambling behaviors, and places that they can refer their clients or patients in the community that they can go to for support or for counseling. And so for the past 2.5 years, we've been actually going throughout the state of California, going to talk to these different groups that I've been mentioning, and raising their awareness about what exists and what problem gambling is.
So if you do, what are the signs or what sort of things identify a problem gambler, and how does it happen in a city where there really isn't? I mean, there's some legal gambling, right? Around the city, or is it all like secret gambling, or what is it? What happens?
A lot of, in fact, access to gambling has never been greater for a couple of reasons. Even though there aren't any legalized and licensed forms of gambling within the city limits, there are many that are very close by, often many who have buses that will come and pick up folks in different points in the community. For example, in Chinatown, gambling buses from different tribal casinos or card clubs will come and pick up folks.
And are they sort of targeting like the Chinese community, or do these buses? This is all news to me. Or do they go around like the whole city and anyone can call them and pick them up, or is it sort of like they know that people like to gamble there, or?
They go to different parts of the city,
but
largely are in neighborhoods where there are a lot of Chinese or Asian persons.
That is so interesting.
Yeah, if you ever go to any of the Indian casinos, you'll see that a good portion of the people there, if not the majority, are typically Asian.
Wow.
There's a lot of marketing, a lot of outreach from gambling establishments towards the Asian community.
Wow, that is so interesting.
I mean, the legalized gambling industry is a huge industry in California. It's a multi-billion-dollar industry, and obviously marketing is a huge component of what they do, and there's obviously a lot of very targeted marketing and outreach to groups. I mean, you know, if you go to various ethnic events like Lunar New Year events, you'll see their presence there, giving out free samples and promotions, and like buses coming in, and we see the same kinds of directed outreach to also different age groups like seniors, like elderly populations, right?
So what are some of the signs that someone has, they don't just like to gamble for fun, sort of? Yeah.
And we know that majority of Americans gamble. We know that as a fact, and we know that majority of people can gamble safely and responsibly, but we know that a handful of people can actually develop problems. And certain questions that we promote or we encourage that people can ask themselves to find out where they're at in terms of their gambling. There's two questions that they could really ask themselves. Really simple. First questions refer to whether a person has ever felt the need to gamble with more and more money over time. The other question has to do with whether they start finding themselves lying to loved ones or those around them about the extent of their gambling. So let me explain a little bit more about those two. First one refers to increasing their stakes. So maybe someone who started gambling maybe mostly did $5, $10 per bets. Over time, finding that now that's not enough. They're finding themselves putting down $50 or going to the high stakes tables, dropping hundreds of dollars per bet just to get the same kind of excitement. So that could be a warning sign.